Hi, thank you for joining us. My name is Dana Cooper, and I'm the Executive Director for the Nurse Practitioners Association of Ontario, or NPAO. We are celebrating nurse practitioners in Ontario and the wide-ranging and valuable contributions they make to healthcare every day by meeting some of the nurse practitioners and getting an introduction as to what they do and what their roles are in the healthcare world we live in. Today, we're talking with Erin Ziegler, and Erin is the chair of NPAO's NP Rainbow Community of Practice and an assistant professor at the Daphne Cockwell School of Nursing at Ryerson University. Welcome, Erin.
Thank you very much.
Erin, why don't we start off by you just providing us an introduction of yourself, your years of experience, the work you do.
Yeah, so my name is Erin. My pronouns are she and her, and I'm a primary care nurse practitioner, and I wear two hats. My one hat is as an assistant professor at the Daphne Cockwell School of Nursing, where I teach in the nurse practitioner program as part of the Ontario Primary Healthcare Nurse Consortium. And I am the course professor for the Advanced Health Assessment and Diagnosis course that a lot of our NPs are familiar with. And my other hat that I wear is I am the clinical lead and director of a transgender medicine program at a family health team in Brampton, where I am the primary care provider for over 150 trans and gender non-binary individuals.
Oh, that must be extremely interesting work and extremely valuable for that community for sure.
Yeah, it's one of the times where I truly feel that patients are grateful and happy and just so at awe and finally being able to get the care that they need, that it's genuinely rewarding to be able to help individuals on this journey.
Yeah, and I heard some of their stories at the one-day workshop you did in 2020. Are you planning to do another one?
Yeah, so part of the NPAO community of practice Rainbow is that we are a group of NPs who are either providing care to 2S LGBTQ individuals or who have an interest. And so we're really just a forum of being able to talk about clinical issues, but also share resources and share clinical expertise. And one of the things that we did was we sent out a survey to all NPAO members to ask them what they really needed in terms of more knowledge or support around 2S LGBTQ issues. And one of the really big things was specific to trans care and how to perform gender affirming health assessments, how to provide care for this population, really looking at it from the perspective of the nurse practitioner role. And so we did a one-day workshop conference called Advancing Excellence in Transgender Healthcare. It was really well received. We had people not just NPAO members, not just from Ontario. We had people from across the country attend, and we had patients come to talk about their experience of being cared for by an NP. And then we also had a lot of guest speakers talk about really what it means to provide gender affirming and inclusive care from a nurse practitioner lens. And yes, we do want to do another version. We want to expand on what we've already provided with more content so that we can really support nurse practitioners in Ontario with providing care to this vulnerable population.
Yeah, it was a tremendous conference. I learned a lot, and you can just see the impact of having compassionate care offered to the LGBTQ plus communities and what it means to them.
Mm-hmm. Yeah, we know that they experience lots of barriers, and so nurse practitioners are ideally situated to break down those barriers to accessing this care. And so I think there's lots of work that nurse practitioners and NPAO can do to improve the access to healthcare.
Yeah, really well said, and a great opportunity for nurse practitioners, I would say. You recently released a stakeholder report called The Responses and Impact of Advanced Practical Nurses for Addressing Health and Health System Needs Resulting from the COVID-19 Pandemic. Are there some highlights from that report that you'd like to share?
Yeah, so that was actually a really big project that I co-led in collaboration with my team at the Center for Advanced Practice Nursing Research. And what we really wanted to do was explore what were advanced practice nurses doing when the COVID pandemic happened? What innovations did they come up with? how did they respond? And so we ended up doing a series of global stakeholder meetings. And so we ran a series of 4 international stakeholder meetings, and stakeholders included the NPAO, so provincial regulatory organizations, professional organizations, researchers, clinicians, academics. And we really brought them together to ask them about what did APNs do in their region? How did APNs respond to COVID, and how were they used? And so it was really interesting to hear all of the different regions and sort of some of the things that were unique to individual regions. So, as an example, in the United States, scope of practice was really increased for APNs in response to COVID. And it showed that the advanced scope of practice didn't cause any patient harm, didn't cause any negative outcomes. So how can we leverage that to continue to expand scope of practice in other areas? And then we also found that in a lot of countries, APNs are not recognized. There's no scope of practice for them. There's no term such as nurse practitioner. And so really starting to develop some collaboration from an international perspective to be able to work together to build on, work that's being done in Canada. How can we support advanced practice nurses in other countries to really advance and develop the role? And, the big thing in terms of how were advanced practice nurses used, it was direct patient care. Virtual care was huge. How did advanced practice nurses adapt to providing the care they provide from a primary care perspective to an acute care perspective virtually? And then also was really big was redeployment. So advanced practice nurses and nurse practitioners specifically being moved into other areas. So being moved into COVID assessment centers or COVID units, ICUs, and how did we support the advanced nurses in transitioning to a completely different area of practice to be able to respond? And one of our participants described advanced practice nurses as a Swiss Army knife, just being able to move and adapt and change and do pretty much anything to really address the needs of the patient, the institution, but also the health system. And so it was really interesting report. The stakeholder report has been published, and we're right now analyzing all of our results, which will then also be going into a peer review publication. And we've done a couple conference presentations about this collaboration and project.
Well, I can sense by the excitement in your voice, that you're very excited about this work, and that's wonderful to hear. Can you just clarify the advanced practical nurse term for anybody that may not be aware? Are they interchangeable nurse practitioners, advanced practice nurse?
Yeah, so the term advanced practice nurse in Canada specifically means a clinical nurse specialist or a nurse practitioner. When we talk about it from an international perspective, that's where sometimes it is a little bit muddied in terms of the roles not being recognized in specific areas. But really, an advanced practice nurse is really a registered nurse who has additional experience, education, and training to provide their nursing at an advanced practice. So in the case of a nurse practitioner, it's that additional knowledge and skill to be able to diagnose, interpret lab tests, order and manage diseases by, different therapeutic approaches. And nurse practitioners is a regulated, protected title, especially here in Canada. And so, advanced practice nursing is really that extra step almost that nurses can do to be able to provide superior care to their patients by using that advanced knowledge that we have to be able to address patient care needs, health system needs from a perspective of clinical, but that's informed by research, is sort of how I see the advanced practice role.
Yeah, I mean, it helps certainly me to clarify those terminologies that we get, we get sometimes confused about. So thank you for that. Mm-hmm. Now, I know you're still working on the stakeholder report and there's still work to be done on that, but are there other research projects that you're involved with involving NPs?
Yeah, so we are, like I said, we are still working on the advanced practice nursing COVID project through the Center for Advanced Practice Nursing Research. We are looking at wrapping up results in terms of projects looking at NP panel size. So how many patients do NPs provide care for, looking at future projects in terms of regulation and really identifying that advanced practice role from an international perspective. So how do we regulate it? How do we deal with specialization? And then specifically for my own work with vulnerable populations, looking at the role of nurse practitioners in providing care to transgender patients. I just completed a study looking at how care was provided in Northern Ontario. So how were nurse practitioners providing gender affirming care in Northern Ontario? And then another study that's going on right now involving nurse practitioners is looking at their knowledge and comfort prescribing puberty suppression to gender diverse youth in primary care. So there's lots of opportunities to really explore the unique work that nurse practitioners are doing and really highlight then the work that we can do.
Yeah, and that's really what we're really trying to do, is just show people what's possible through nurse practitioners. Now, in some of our efforts, NPAO is moving forward on, and I'm going a bit off script here, Erin. So we're moving forward with the development of a position paper on patient enrollment with NPs and data capture. I believe you're well aware of that. And so how important is that? You sort of alluded to it there in some of the work that you're going to be doing and want to do in terms of how many patients do NPC and that sort of thing. What would something like that mean, an advocacy from NPAO on that initiative mean for that effort?
Yeah, and I think it's still that we're advocating for what NPs can do. And, the current framework for paying NPs is really, a funded position, a salaried position. And so to get a position funded, it's that value added. What can we show the funders that support the need to fund this position as a nurse practitioner position versus another allied health professional? And so, really advocating for that understanding of this is what NPs do, this is what they can do. Look at what they can manage in terms of number of patients that they can care for as an example, as a primary care nurse practitioner, but in an acute setting or a specialized model, look at the additional, the additional training that these advanced practice nurses have to be specialists in migraine management or heart failure or any number of things, and really highlight what advanced practice nurse practitioners can do, so that funding, government, but also the general public really understands the value added that we give to the healthcare system.
Yeah, back to the Swiss Army knife analogy, right?
Yes.
Well, thank you very much, Erin, for taking the time to give us insight into the incredibly valuable work that you're doing, in the NP Rainbow community of practice, as well as the research you're doing, in terms of the advanced practical nurses and what they're undertaking as well. So I really do appreciate you for taking the time. But one last thing, just as we're celebrating NPs, what makes you proud to be a nurse practitioner?
What makes me proud is the work that I'm able to do to address the healthcare needs of the trans and gender diverse population, in terms of the work that I can do by reducing the barriers that they experience, getting them access to the care that they really need. That's life-saving for these patients. And it's really valuable to me. It makes me excited about going to work. It makes me excited about doing the research. But also what really is valued to me is educating the new NPs. And so I really, really love working with the students in terms of precepting them in practice, but also teaching them in their classes, to be able to foster and encourage that development of the advanced practice nursing education to, their students now, they're going to be colleagues in a couple of years, and then to be able to collaborate and work with them. It's really exciting.
Yeah, that is wonderful. So thank you so much, Erin Ziegler, Chair of the NPAO's NP Rainbow Community of Practice and Assistant Professor at Ryerson at the Daphne Cockwell School of Nursing. So thanks again for taking the time. Really appreciate it.
Thank you. Have a great day. Happy Nurses Week, NP Week.
Thank you.